One of the challenges with neck pain and with injuries and degenerative conditions of the neck, the cervical spine, is cervical radiculopathy. What is it and what symptoms would you have? Let's discuss that in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Cervical radiculopathy is a term used to describe a pain syndrome caused by compression or irritation of nerve roots in the neck, the cervical spine. It most often stems from a degenerative condition. It may be degenerative disc disease of the cervical spine, or it can be an outright disc herniation of the discs in the cervical spine. And that leads to narrowing of what are called the neuroforamina, basically the exitings of where the nerves come out of the neck. So if you look at this model of the cervical spine, the nerve roots come out from what are called the foramen between the vertebral bodies. And then those are the nerves that basically they form bigger nerves that go down your arm. They basically give you sensation. They give you strength of the muscles in the arm, forearm, hand, and obviously sensation to that. And so when you get compression of those nerves, then that leads to motor difficulties like weakness in certain muscle groups, or sensory changes, meaning numbness of particular areas in your hand or fingers, or maybe reflex differences. It can also be accompanied by painful neck issues with neck movements, muscle spasms, and like I said, numbness, tingling, and weakness in different parts of your hand, your fingers, your wrists. It depends on which discs it is, which nerve roots are basically being pinched or compressed, and that leads to a variety of different symptoms. Where this becomes an issue for military veterans is if you have a degenerative condition like a degenerative disc disease that builds up over time due to medical conditions or physical conditions that were either an injury while you were in the military or just repetitive wear over time from your duties over a long period of time in the military, it leads to something like a degenerative disc disease. Now you've got this issue down your hand, into your fingers, especially if it starts up at your arm, goes down. That very likely is secondary to the cervical spine condition that was caused in the military. And so it can be very often something that somebody like me who writes Nexus letters for orthopedic injuries argues is either caused by the military or it's secondary to an already service-connected cervical spine injury. Now, if you have ideas for topics for future videos for this channel, whether it's Nexus letters or DBQs or injuries or risk factors or really anything else, leave those in the comments below this video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter for your injury or condition, click the link in the description below and you can learn more about working with me and my team. We do everything we can to make the process simple, to make it as quick as possible for you, and I really try hard to write a Nexus letter that gives you the best chance of success in your disability claim. Thanks for watching, and I look forward to working with you.